In this video lecture, we'll be reviewing psychological treatments for anxiety disorders. Our most common psychological treatments for anxiety disorders are forms of behavioral therapy. And one thing that all of these treatments have in common is that they are exposure-based therapies. So these therapies are based around the idea that our anxiety disorders represent conditioned associations between the phobic object or situation and an anxiety or stress response, and that these conditioned associations are maintained by an individual's avoidance behavior. So because they do not engage with their phobic stimulus or the situation that makes them anxious, over time that association becomes stronger and may even generalize to new situations. So in exposure therapy, we are using learning principles and we are exposing the individual to the phobic stimulus or situation in order for that conditioned association to be extinguished or to be replaced with a new conditioned association. There are various ways that we can do exposure therapy. So one option is to do something called flooding. This is when you expose an individual to their phobic stimulus or situation at a very high level until they have habituated and are no longer experiencing their fear response. For example, there is a therapist who specializes in the treatment of fear of flying, whose primary treatment is to take his clients and have them meet him at JFK. They get on a plane together and they fly to Europe, and then they get back on a plane in Europe and they fly back to New York. If the individual is still experiencing a fear of flying, they will get back on another airplane before they even leave the airport, fly back, and then fly back to JFK again. And usually by the time someone gets to this point, they have been habituated enough to the flying situation that they are no longer experiencing that anxiety response. This is a somewhat extreme example. It is often only used by individuals, for example, people in business careers where they need to fly. Perhaps they've reached a level of their career that they are not able to get to a higher level in their career unless they start doing more travel and start being able to fly. So many individuals find flooding to be very aversive. So if someone comes into therapy and they say, I'm here because I'm afraid of flying, it can be a hard sell to say, okay, we're going to treat your fear of flying by having you hop on an airplane and fly across the Atlantic. But it's a very effective treatment option. So if an individual will engage in flooding therapy, it can lead to dramatic reductions in the anxiety that they experience when they encounter their phobic stimulus. A more common approach to exposure therapy is something called systematic desensitization. So in systematic desensitization, you expose an individual to their phobic stimulus or feared situation, and you start at a level that produces a low but still distressing anxiety response. You repeatedly expose the individual at that level until they've habituated and are no longer experiencing the intense fear response. And then you increase in the level of severity of the exposure until the individual is able to tolerate situations where they're exposed to something at a very high anxiety provoking level and are no longer having that anxious response. So for example, if you have someone who is afraid of heights, you might start by asking them to imagine that they are standing on a balcony or standing on a ledge. You might read stories or watch videos of people being in high up situations. Then you might do some in-person exposures where they are climbing staircases or standing on a curb. And over time, you might work your way up to higher levels of anxiety-provoking situations, such as being on a balcony in a tall building, going up to the top of a skyscraper, or any other kind of situation where the individual might experience a high level of anxiety. So in that example, you can see that there are various ways to use exposure therapy. You can use what is called imaginal exposure therapy, so having a person imagine being in a situation or think about it at a high level of detail. And you can also do in vivo exposure therapy. So this might be completed by the individual as part of their homework for therapy, or you might actually do this with your client as a therapist. So you might be going out into the community and doing exposures for social anxiety, or you might be going to the zoo with a client with a snake phobia or a spider phobia to do in vivo, in real life exposures to their phobic stimulus or the kinds of situations that provoke their anxiety response. And all of these various approaches to exposure therapy, whether we're using imaginal or in vivo exposure, and whether we're doing it all at once with flooding or doing it gradually with systematic desensitization, all of these are effective ways of reducing people's anxiety and helping eliminate that avoidance behavior that is maintaining their anxiety. We're going to wrap up talking about behavioral therapy by talking about a specific form of behavioral therapy that is called applied tension. Applied tension is a specific form of behavioral therapy that we use for our blood injection injury phobias. So remember that our blood injection injury phobias have this unique characteristic where the physiological response that an individual experiences is a drop in blood pressure and sometimes even fainting. So rather than attempting to reduce an individual's physiological anxiety when we're treating a blood injection injury phobia, what we actually want to do is to increase their physiological arousal to prevent this drop in blood pressure and prevent this fainting. So in applied tension, we teach individuals physical strategies for increasing their blood pressure and their heart rate, and have them practice this in situations where they are exposed to the objects that lead them to have this fear response. So for example, you might do applied tension and expose people to needles or to being in the doctor's office or to a phlebotomist who is wearing a white coat. An important component of this, you'll have your patients take their hands and just clench them repeatedly to bring their blood pressure up and increase that muscle tension. And applied tension can be used very effectively. Often it takes only 1 or 2 sessions to teach individuals how to use these behavioral strategies to keep their blood pressure up and to avoid this conditioned response where they have that drop in blood pressure and experience that fainting when they are presented with their phobic stimulus. So here's an example of the kind of exposure hierarchy that you might use if you were a behavioral therapist working with someone with a spider phobia, if you were planning to use systematic desensitization to treat their spider phobia. So on the left-hand side, you can see that this patient has listed a range of situations that they would find frightening and distressing. And on the right-hand side, they have rated these situations on a scale from 0, which is not scary at all, to 100, which is the most scary thing this patient could think of. This scale is sometimes called subjective units of distress, or SUDS, and can be a way of checking in with patients to see how anxiety-provoking they find a particular situation. And you can also check in during exposures to use this scale to ask an individual how much anxiety they're currently experiencing. So this individual rates some imaginal exposures, like thinking about a spider, as very low. And then we have some potential in vivo exposures that the individual might engage in during later phases of therapy, where they are actually looking at a spider in a closed box, where they might be getting physically closer to the spider. And ultimately, the goal of therapy would be to have the patient let a spider crawl on their arm and be able to tolerate that experience until that very intense distress went away. So over time, by gradually exposing the individual to things higher and higher on their fear hierarchy, their spider phobia would decrease over time, that conditioned fear association would decrease in strength, and they'd be less likely to engage in the kinds of avoidance behaviors that are causing distress or impairment. We're going to finish up by talking about cognitive behavioral therapy, and as you might guess from the name, in cognitive behavioral therapy, we're combining these exposure-based elements of behavior therapy for anxiety disorders with the same kinds of cognitive components that we saw in cognitive therapy for our other disorders. So the C in CBT for anxiety has to do with helping individuals identify and challenge their maladaptive thoughts. So for example, for somebody with a specific phobia of dogs, beliefs related to how dangerous dogs are, you might be engaging in cognitive therapy to help them challenge these beliefs and help replace these beliefs with more adaptive beliefs. For someone with social anxiety disorder or social phobia, you might be challenging beliefs about how much attention other people are paying to them and the kinds of judgments that others are likely to make of their expressions of physical anxiety or any negative things that others might observe. And if you're treating someone with generalized anxiety disorder, you might be helping challenge their ideas about worry and helping them replace those beliefs with more adaptive beliefs about anxiety and other effective coping strategies. So these cognitive strategies that we saw, for example, the use of an automatic thought record like we used with the treatment of depressive disorders, will be combined with our behavioral strategies and exposure therapy. So one way that exposure therapy is often combined with cognitive therapy is something called behavioral experiments. So for example, you can have an individual test some of their cognitions about predicting how likely something negative is to happen by having them expose themselves to that circumstance and then keep track of what actually happens. So for example, if you have someone with a dog phobia who's avoiding going for a walk in a park outside their house because they're worried that they're going to encounter dogs and that the dogs might be aggressive, you might ask this patient to make some predictions. You could ask them, how many dogs do you think you are going to see? Out of those dogs, how many of them do you think are going to act aggressively towards you? How many will bark at you? How many will try to bite you? How probable do you think it is that you will actually get bitten? If you get bitten, how bad do you think it will be? Do you think that you will have to go to the hospital? And then you will have them engage in exposure and maybe go for a walk in that park near their house and keep track of the evidence to support their beliefs. So they might be keeping track of how many dogs they see, how many of those dogs bark at them, how many of those dogs try to bite them, and then use that information to help challenge those predictions and to come up with more realistic beliefs about the world. So in CBT, we can use cognitive therapy to sometimes make these exposure-based therapies even more effective for helping change these beliefs that are maintaining anxiety and helping reduce these avoidance behaviors as well.